So a couple of years ago, what we were making was impossible at all.
Yep.
Now it's possible to have information before the surgery that usually the surgeon got during the surgery.
It's very nice to meet you. Could you present yourself for the viewers?
Okay, so my name is Mathieu. I'm the CEO and co-founder of Twinsight, which is a French-based company. We are 5 years old now, and our mission is to make preoperative planning software for orthopedic surgeons in order to make better planning before the surgery.
Okay.
And as we're in orthopedics, we pick a first indication, which is a total knee replacement.
Okay. 5 years is quite some time for a startup. You have the green
Beige.
stage. So you're at the scale-up stage, and you are looking for investors to get to that next step.
So we already raised 0.6 as a pre-seed 2.5 years ago. Our investors are all individuals, angels, mainly orthopedic surgeons. We wanted to be part of the game. Wanted to contribute as well to the next stage of the company. And we just got our first 510(k) clearance for the US market.
Yeah.
That means that's why we are raising more money now, much more for the US commercial launch. To get more US surgeon on board, more US traction, and interest even better the medical device manufacturers.
Okay, is this your first year at the conference?
No, I was already last year in Bruges.
Yeah.
So actually it's a really nice place here. The venue is wonderful and engaging for a lot of conversation, and I think it's a productive meeting.
That's great. How did last year's edition help you grow your company?
I think each pitch is a new stage. Each pitch is a way to present the company, to have also some feedback from several investors, at least European investors, and it's a factory growing. I mean, we need to spread the word to the world our innovation, and we need to talk about it, and that's the way the innovation will come through for the sake of the patient and even us as a patient.
Yeah. We know that there's a lot of conferences happening in the world, but especially in Europe, all throughout the year. Maybe you can tell everyone watching how this conference has impacted you and your company through the people that you meet, through the reverse pitches from investors. How is that going on, and maybe why are you coming back?
I think it's a result of the time of the year. It's one of the last events of the year, so it allows to wrap the year and be ready for the next year. I think it's important to keep the momentum and see that you are here and keep going with the discussion. So you need to spend some time. It's today a lot of things are happening virtually, and for me it's not enough. It takes time to present your technologies and your solutions and your needs. And I think as well having an investor in your company as a co-founder is a team which is expanding. So we need to be sure we have the right partner. Yeah. And it's not only investors putting money on the table, it's a true relationship. You're opening your capital, you're opening your baby to other people. So I think it's really a human being exercise, and that's why real events are definitely a must-have.
Okay, maybe in the idea of opening up, maybe you can go into more specific about your company, the technology that you're building. Do you want to explain a bit more how the future is looking and what investments can do to help you grow?
So we are in a world where there is more and more data, there is more and more computing, and people would like to have access information quite immediately. So a couple of years ago, what we were making was impossible at all.
Yep.
Now it's possible to have information before the surgery that usually the surgeon got during the surgery. And it will come from a nice to have to really to a must have. And I think what's really important is that our technology can scale up. With the new technology we will come, maybe tomorrow there will be more motion captures. There will be real time, even with your smartphone, you can have a lot of data, and our technology will support that to make a kind of a closed loop with this digital twin, with the information which will be fed from sensors, from robots, from surgeon expertise, and this is still the only way to create more added value to the healthcare.
Yeah, I think adaptability is clearly one of the most important pillars when you're building in health tech, because and as you said, so many technologies, so many new data are coming out each day that you have to follow up and you have to keep on track. Being at the stage of a scale up, it's so important to stay on point.
And I think it's agility, but in the meantime, we have this kind of roadblock, which are also all the regulations, the fundraising, which you need to have in mind. So you need to dream as a co-founder, as a startup leader, I would say, but also to have the foot on earth, because this is the reality. You have your paycheck to do on a monthly basis and so on. So it's how to make, with the maximum agility, try to be as flexible as possible, but in a tough world.
I mean, that's why it must be interesting to start and looking to the US, which is completely different in terms of regulation.
Yeah.
I think we have a very good mentality in Europe of saying, considering all the regulations, if you can succeed, then you're sure to grow very fast. The lack of regulation, how are you dealing with that in the US?
It's not a lack of regulation. I think the mindset is a bit different. FDA is a governmental institution in the US in regards to notified body, which are not powered by the Europe. So that's the business model, I would say, is different. The business model is different, and sorry.
It's fine. We can start again. The lack of regulation, as I said, in the US.
So it's not a lack. I think the regulation is a bit. Is the mindset differently. Is even the sales process in the US or sales process in Europe is different.
Yeah.
You have different. It's a different strategy. So you need to make the budget for it, put the resources for it, and I think it's I disagree. I'm sorry. It's not a lack of regulation. It's much more a different style of regulation.
Yes. Okay.
And the business is different as well. So again, it's a question of budget. It's like a sub project.
Yeah.
How do you go to the market? Because you talk about regulation, but there is also the market access with reimbursement code and things like this. So it's not because you have the regulation clearance that you can sell.
Yeah, of course.
You have the right to sell, but making true sales and revenue a sustainable company is a different story.
And we compared Europe to the US, and we forget that Europe is 26, 27 countries. The regulations are an aspect of Europe that allows us to trade in between cultures and countries, whereas the US, it's one state. So as you said, yes, it's more federal. And as soon as you get into the market, then you can expand quite quickly.
Yeah.
Maybe we're getting to the end of the conference. It's the third day. What is a message that you want to give out to the viewers about your company or about the conference for next year's?
I think it's a perfect space if you have an innovative company and you would like also to talk with other people. Definitely digital twin is a new trend. Last couple of years was AI, now it's digital twins, and personalized surgery will come accessible and be. I like to summarize it that we are the missing piece of a complex ecosystem, which give consistency, and all the investments that are made with implants, with robots, with all the patient experience. We just crystallize all the energy, and I think we can easily contribute to a better value-based healthcare system.
Okay, thank you for being here. Thank you for talking with us, and have fun for the rest of the day.
And enjoy.
Thank you.
Bye-bye.